Hi everybody, welcome to Healthline. Happy summer. Are you spending time at the beach? Are you outside? Are you turning off the TV, closing your computers, getting off your iPad and your iPhone, and you quit gaming just to go outside and enjoy and live your life? Our mission here at Healthline is to make you the happiest and healthiest you can be. Our conversation today is about drug and alcohol addiction. I did a little Googling before I came in, and I just wanted to share with you. Did you know that over 20 million people nationwide suffer from drug and alcohol abuse issues? And worldwide, that's over 240 million people are alcoholics. What is an addict? What is an addiction? Do you have somebody in your life or one of your friends, family members that suffers from drug abuse, alcohol abuse, smoking, gambling, sex, shopping, even watching TV can be an addiction? What is it? Is it hereditary? And is there someone you love that you want to send out for help? Joining us from Adventist Health Glendale is Dr. Charles Peterson, and from Adventist Health Glendale, Scott Robertson. Scott, doctor, thank you so much for being here. Dr. Peterson, what is your medical background?
I'm actually a family medicine doctor by training.
Okay.
I did my training here at Glendale Adventist. And we actually have a training junction where we work directly with the addiction program at Adventist Health as residents, and then I'm deciding to go into a fellowship for addiction medicine as well.
That's fantastic. And Scott, you have been a regular, and we have been talking about this for years. Can you share with us your history again?
Sure, Greg. I've worked at Adventist Health Glendale for about 27 years and was the director of the addiction program for about 20 years, and I'm the director of behavioral health and recovery services at the hospital today. So I've a little over 30 years working with people with substance use disorders and serious mental illness.
Before we even head off into our first break, what is addiction, Dr. Peterson?
Addiction, it depends on how you want to define it. Everyone defines it a little bit differently.
They do, don't they?
They do, and so when you look at someone who has addiction, you look for behavioral patterns most often, and you look for something that's related to a substance. So most people already know they have a substance use, marijuana, alcohol. But are you addicted to using it, or do you just use it recreationally? So most people who are addicted will use it habitually. They have more cravings, they use it more and more frequently. And you might find that the behavioral aspects also exist. So people might start noticing that they're neglecting their everyday responsibilities. Work, school, children, loved ones.
Commitments.
Social obligations.
Your life changes.
You always see those people on social media that say, oh, I'm busy, I can't go out tonight. And then you see a post of them in bed with a cat, right? And they're watching Netflix all night, something of that nature. And so they start to give up some of their regular social obligations, hobbies, interests, because of the substance in which they're using.
Because then you then become more committed to the substance than you do your lifestyle.
Your everyday obligations.
Scott, in a sentence, what is addiction to you?
Well, it's just the loss of control over whether or not a person uses alcohol or another drug, or as you mentioned, a process. You know, they do a behavior recurringly, and they've lost their ability to choose whether or not they're doing it. It's that.
Thank you, Scott. More on addiction and alcohol and drug abuse when we come back. Don't go away. Welcome back to Healthline. I am Gregory Zarian. Did you know that Adventist Health Glendale is a top-ranking best hospital by U.S. News and World Report in Los Angeles and all of California? They were also recognized for 5 categories of care. Did you also know that Adventist Health Glendale is proud to continue to be voted the best hospital as voted by the City of Glendale residents in the Glendale News Press Survey? That is 4 consecutive years in a row. Thank you, Glendale. Joining us today is Scott Robertson and Dr. Peterson from Adventist Health Glendale, and our conversation is all about drug addiction, drug abuse, and just addiction in general. Dr. Peterson, you said before we went to break that it's behavioral patterns, things changing. Scott said the same thing, that our lives are changing. First and foremost, is addiction hereditary?
There is some hereditary component to addiction. We do know that. But there's hereditary predispositions for lots of things, even like obesity, diabetes. But there's things that you can do to avoid those things, to treat those things, to not put yourself into a category where you're more likely to become vulnerable or susceptible to those things.
But then here's a question. Okay, just say in a family of 4 children, mom and dad were alcoholics. Scott, will all the kids end up being alcoholics or addicts, or is it very selective?
That's a great question, Greg. You know, there was a really irresponsible article on the cover of Time magazine years ago that said that they discovered the gene for addiction. And that was one geneticist study that was never replicated. There's proof, you know, that it can be environmental and it can be genetic. So some of those kids might grow up and see the example of their parents and have a great aversion to ever picking up drugs or alcohol.
Which is fantastic.
Absolutely. The others may see it and think, oh, you know, I like how they party. I like the fun they're having. I'm going to try it. And that's the risk that Dr. Peterson was talking about, is exposure. So there's an exposure risk when people grow up with alcoholic parents.
If mom and dad are doing it, then it's shown to be okay to the kids from a very young age.
You mentioned earlier obesity. Is obesity, well, it's food, so it's an addiction, other than it being a physical malady or something that is, you know, you are born with that you can't take care of, like a slow-moving thyroid or something like that. But is it the same idea?
If you have an eating disorder, perhaps some people do the same
Because eating
things.
is addiction as well. It's food.
There are recovery programs for all of these things. And the recovery programs for food, they identify the same way as the recovery programs for alcohol and other drugs. That the first step is that a person could admit, along with other people, that they're powerless and that their lives have become unmanageable as a result of that loss of control. Same thing can apply to food. Same thing could apply to the other examples you mentioned earlier, like gambling or sex or work,
shopping,
religiosity. There's all kinds of things that people can have a mind-altering relationship with.
So an example, when mom and dad who are suffering from obesity and the kids see mom and dad really not getting a lot of exercise and eating unhealthy, parents are teaching their kids from an early age how to live their lives. So that's what, as you said, doctor, mom and dad are going out, they're drinking, they're having a really great time to excess.
Correct.
Are they teaching their children then that it's okay to overdrink, overeat, overuse? So then, Scott and Dr. Peterson, what do you then say to patients and how they teach their kids
You're
about
always
food
trying
and
to
eating?
tell parents to lead good examples for the exact same reasons we just mentioned. And so I get an opportunity to do that as a family medicine doctor only when patients come to me. So if a parent's bringing their child in for a well child visit, I can use that as an opportunity to say, what kind of foods are you eating? Oh, are you exercising? Are you doing any extracurricular activities? Are you doing any sports? And the parents sometimes will answer for the kids, but sometimes the kids answer appropriately. They throw the parents under the bus.
Because a lot of it's also culturally too.
Yeah, and that's not an issue, but it's my job to educate them and say, well, you should be exercising X number of minutes per week. You should be getting a well-balanced diet. You shouldn't be having tortillas or milk every single day for every single meal. And then I get to teach both of them at the same time.
And how are the parents when they get called out?
Sometimes there's how we are. They smile, they smirk, their faces turn bright red. You know, they make a joke about it, but oftentimes they say, well, that's just the way it is.
Go, Scott.
Greg, there's something else that I could say. When we get people into treatment, you know, there's 2 approaches that I'd say are really important with issues
And when you say
like you're talking
treatment,
about.
it's recovery.
Addiction treatment.
Addiction, okay.
Yeah, like we do at Adventist Health Glendale. When we get people into treatment, we give them a structured day that includes like a morning meditation, a morning walk, movement therapy like yoga, group therapy. We have very, very much planned meals that are healthy and balanced. So we set them on a path of structured living that might be 180 degrees from where they come from. So for that short time that they're with us, we expose them to like healthy, whole person care. We aren't just narrowly treating the addiction disease, we're really helping them to understand their whole body, their physiology, their overall health. The other thing related to parents and children is in family therapy group there, we validate reality.
Oh, I love that.
You know, so kids come in and they've seen these horrendous examples, and we'll give, you know, patients new in their treatment the opportunity to read a letter to a family member that says, the impact of my drinking on you, to say a 12-year-old child, has been this. And they'll validate, they'll say, I know I wasn't there for you to pick you up at a sporting event. I know that I missed times when I said I'd be there for you. I know you saw me under the influence, and you shouldn't have to see me that way. So we'll validate that experience for kids. And sometimes for the kids, it's the first time the parent said something that rings true.
That also touches them and touches the parent, because the parent is being honest and the child is finally hearing them come clean. More with Scott Robertson and Dr. Peterson when we come back. Don't go away. Welcome back to Healthline. I'm Gregory Zarian. Joining us from Adventist Health Glendale is Scott Robertson and Dr. Charles Peterson. Scott, before the break, you were talking about treatment. What are then some of the signs and symptoms of, let's just say, alcohol or drug abuse?
Sure. From kind of a global sense, Greg, when substance use disorder is a problem, it means that the drinking or the drug use has started to interfere with a person's ability to function in important dimensions of their life. So for instance, for a younger person, it means they're missing school. For an adult, it might mean that they're not showing up at work, or they're not showing up for commitments in their family. Then there are a whole set of physiological symptoms and behaviors that are signs as well.
Thank you, Scott. But Dr. Peterson, you also addressed some of that as to what Scott just said about patterns changing. What are some of the physical things that happen to someone that are suffering from addiction and alcohol, drug abuse?
Well, if you see someone that you happen to know the substance that they're on, there's those classic signs and symptoms that someone's actually intoxicated, right? So you might see those signs and symptoms more frequently. That might be slurred speech, disorientation, spacing out. People might have trouble sleeping. They might have anxiety. They might have depression. They might rapidly swing between anxiety and depression. Mood irritability sometimes is the only thing that people notice. Oftentimes you can see things in the eyes, the classic red eyes where someone's intoxicated, or the small pupils, the large pupils, the eyes that are kind of dancing or shifting back and forth. Might be something that means they're actually currently intoxicated on a symptom.
So then here's my question. Somebody you love, friend, family, you can just tell they're suffering from an addiction. Drugs, cocaine, alcohol, whatever that is. How do you, in a loving way, say, hey, you know what, I think you're in trouble? How do you present to them? I know earlier you mentioned something about a group setting where you can write a letter and say the cause and impact of what addiction is. And in a perfect world, people would be like, hey, you know what, I love you, I'm sorry, or whatever. How do you bring the resistant to wanting to become clean and sober?
Well, Greg, what you mentioned is an intervention. And I've done maybe 500 interventions in my working career.
We've talked about
really
really great
process. And what happens is that's a formal process. Informally, in families and in relationships, people can point out to the person who's using, in a kind way, a change in behavior, a change in the relationship, direct observation of drug or alcohol use, financial consequences, the things that have changed and the things that have been problematic. Until the person sees them, they have little cause to look at their own behavior. They might be quite defensive.
They do become defensive.
Of course they do.
Friends and family that are like, listen, you're counting my drinks, I'm going to go have another drink. So how do you then, is it then up to that person that wants to say, hey, you know what, I can't do this anymore?
The same thing that happens in an intervention, Greg, happens in lots of healthy relationships. And that is the person establishes a boundary.
Oh, I love that.
They could say, when you're drinking, I don't want you in my house because I don't want my kids to see you that way. I love you. My kids love you. I want my kids to see the best of you. And when you're loaded, that's not the best of you.
Doctor, what do you then say to, I'm sure you have patients that come in and somebody will say, my mom's an alcoholic, my brother's a drug addict. How do you coach them in regards to handling that? You
have to tell them they have to ask. They have to ask the person about it. The boundaries is a great option. Setting a limit to take something away from them is a good option. The children, that's probably one of the biggest ones I see. Someone says, I'm not going to let you see the children anymore. I'm going to no longer do this. People at work will say their bosses are making them take time off because they've seen them intoxicated. Maybe they have a job where they operate heavy machinery and they could hurt somebody. Maybe they operate a job where somebody else's lives are in their hands. And so somebody actually takes the reins away from them. And they use that as an opportunity to say, are we going to help you change? We can use this to our advantage and say, now that we are aware of this, you can either do option A or you can do option B. And some people that works.
And for the other people that it doesn't work, is it tough love? Is is it they then have to become, as the saying is, rock bottom? They have to hit their own rock bottom and lose everything so that they can finally reclaim something?
Not at all, Greg. You know, I mean, thankfully, interventions, what we do at the hospital and what happens in other places too, an intervention is an act that brings about raising the bottom. You know, because if the person's spiraling downward and they can begin to see the progression of their disease, they see that it's gotten worse over time, an intervention can help them to address that. And people, they do want to get well. You know, something that's not very well known is that people in treatment for substance use disorders are about as compliant as people getting treatment for hypertension in their doctor's office.
Oh, interesting. Wow.
In other words, 3/4 of them do exactly what the doctor tells them to do. So we're not talking about willful, difficult people. You know, when a person has decided to get well, they very often follow through on all the directions that are involved in treatment.
Because, I mean, here's the fact that we've seen, I mean, especially in the world that we live in today, with all the social media and the news and like even celebrities, you know, Prince, Whitney Houston, Michael Jackson, all these people that had all this treatment, everything at their fingertips, and the addiction was stronger than their wanting to stop.
You know, Greg, you bring up something very interesting, and I think that all of us, if we could find compassion, you know, for people with substance use disorders, the nature of the disease is that they've lost their ability to choose whether or not they're using. And many of the celebrities that you've mentioned, they didn't have a fair chance at treatment at all. They get treated differently in every interaction that they're involved in. Everything, instead of a relationship, turns into a transaction for people who are very wealthy,
fascinating.
very famous.
Because of their famous status.
That's right. They're treated differently. They don't get a fair shake in treatment.
More with Dr. Peterson and Scott Robertson when we come back, and we're also going to share with you what treatment looks like at Adventist Health Glendale. Don't go away. Welcome back. The conversation is all about addiction and drug abuse. Joining us from Adventist Health Glendale is Scott Robertson and Dr. Charles Peterson. Adventist Health Glendale has this great treatment program. Talk to us about it, doctors. Dr. Peterson?
Adventist Health has had this program for a number of years. It's not directly connected to the hospital, so it's off-site. It's a program that you can go to for free assessments. It's a program that you can go to that you're not required to stay if you don't want to. It's a program that you can come and go. It's a program that's not a locked facility. Some facilities tend to be, and that tends to scare people, frighten people. It makes them feel trapped, that they're not there voluntarily. So that's definitely something that makes it a very unique program. It does follow the classic 12-step programs, which many programs have. It's at least some component of their program.
And each program, though, considering, be it sex, be it gambling, debt addiction, and even Al-Anons, people that are involved with people that are alcoholics, how to get their lives back. They each have their own.
Exactly.
Same idea, but different 12 steps.
It's a variation on the initial 12-step program that was created by the Alcoholics Anonymous, and they follow the same principles, the same steps, only with a different substance, kind of
depending on what
you're. Correct.
Dr. Scott?
Well, you know, in the treatment program itself, we have 5 different levels of care. Some people are going to have physical withdrawal symptom when they stop drinking or using, and if you're watching, you know, if you want just one message, if you know someone is going to change their use of alcohol or another drug, urge them to seek medical attention. Like acute alcohol withdrawal syndrome, not everyone will have, but those who do, 20% will probably have a seizure if they're not treated with medication. So we have detox at the medical center itself. We have subacute detox at our residential center, so that somebody wouldn't have to go stay in the hospital for 5 days, but maybe a day or two, and finish at the residential center. Then residential is a maximum of 30 days. We also have day treatment and outpatient programs for people whose addiction either hasn't progressed or who still have an intact family system where it's safe and okay for them to still live at home or go to work. So 5 different levels of care. Treatment is very individualized, and it includes then a whole year of follow-up care and family therapy a couple times a week all the way out till 6 months.
And I really like that you said family therapy, because addiction is a disease.
Absolutely.
And it's not just the person that has the addiction, it's the family and the friends, because we all suffer from those choices.
Every person who's directly in contact with them, will be affected by these people. Yeah.
What do you both say to the people that are affected by the disease of alcohol or addiction, and somebody you love is a crystal meth addict? What do you say to them in regards to your own recovery as somebody is detoxing and going through rehabilitation? Scott?
Well, there's a whole community of support. Southern California is the most amazing place for recovery. There's more than 3,000 recovery meetings of one form or another. There's Alcoholics Anonymous, Cocaine Anonymous, Crystal Meth Anonymous, Marijuana Anonymous,
Nicotine Anonymous,
Nicotine
Debtors
Anonymous,
all of it.
absolutely, Gamblers Anonymous. There are men's, women's, and women's meetings, and there's a place to find a community, because many times what happens in substance use disorders is people become terribly secretive and emotionally isolated. And treatment brings them back into the fold with other people, with their families, and with society as a whole. So finding a community is a really important part of the recovery process.
Or at least finding the community that you think you identify
Yeah.
with. You can go to a meeting and not really like the people at that meeting, and you're not really going because the meeting is not helpful. You're going because you don't like the people that you're interacting with. And so if you can find one of these programs that you like the people you identify with, then you're more likely to want to go to these programs and seek the treatment that you deserve.
But also, bottom line, though, it's about the message. It's not about
Correct. It's the
people.
message that program is offering you. It's not about the people, but sometimes that's the reason people don't want to go. So don't let that be a
What
reason.
do you say to someone that is watching this show that is suffering from alcohol abuse, that is a cocaine addict, that is in their room by themselves on the computer, and they are just wired and they think they're alone? Scott, what do you say to them?
Well, the first step in recovery is reaching out to somebody else. Nobody gets well from addictions sitting alone in a room. So, it could be the phone call, it could be the internet, it could be walking into your local emergency room, it could be making a phone call to an addiction treatment program like ours, it could be calling one of the 12-step helplines and going to a meeting for the first time. There's all kinds of resources. Some of it involves money or health insurance, and a lot of it is free and in the community. But you have to reach out to somebody else to get started.
Dr. Peterson?
It's this, I would say the exact same thing. You have to want the help. And if you're not willing to go for the help, then it doesn't really matter who you're going to call anyways, right? Like that old proverb, lead the horse to water, but you can't make the horse drink, right? So, telling them, when you want help, these programs, these services are available. As long as they know when they're ready, at any moment's time, they can go, because at one point they will call. At one point they will ask for help. At one point we'll be there.
Scott, if somebody is watching this or has Googled you and me in this show, because we have talked extensively, we're talking episodes and episodes and episodes on addiction, how can someone find you and how can someone get help at Adventist Health Glendale?
Really easy. They pick up the telephone and they can call. The addiction program itself is 818-242-3116. The medical center is 818-409-8000. My name's Scott Robertson, and you can call and ask for me, and they'll put you directly to my office, to my desk, and I'll pick up the phone whenever I'm there or return a call right away.
Thank you, Scott. Dr. Peterson, final thoughts?
Don't be afraid to ask for help. You're not alone. Substance use is out there. It's predominant. Some people, even if they're not ready to quit, but you think you might be thinking about it, you think it might be affecting your life and you want help, ask for help. Sometimes it's just about setting up a plan, and maybe I'm just step one of your plan.
And having a conversation.
Yeah, I can't help patients that don't come in to see me. I can't help patients that I don't talk to. So the best thing is, come in, don't be afraid to talk to your doctor, ask for help.
So you heard it from Scott Robertson and Dr. Peterson. You're not alone. Bottom line is, addiction, people die from addiction. As I named celebrities and singers earlier, they had the world at their hands and they still died. So if you or someone you love is suffering from any type of addiction, pick up the phone, Google, there's online chats, talk to your mom and your dad. There is help, there is recovery, and there is an amazing life waiting for you. All you have to do is say, hey, I need help. There's a beautiful prayer after every meeting. It's called the Serenity Prayer. God, Grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. Take a moment, talk to God, ask for help, get your life back. Thank you for joining us on Healthline. You can also find us on all types of social media, on Facebook at AH Glendale, Twitter at Adventist Health, LinkedIn at Adventist Health, and you can always find me at Gregory Zarian. Remember, the most important conversation you're going to have is about you and your health. So why not have one now? We'll see you next time.